The flu. To find out more, we're joined now on Teams by Dr. Vinod Tahilramani, a specialist in internal medicine at Emirates Specialty Hospital. Dr. Vinod, thank you so much for joining me on the line. How are you?
Yeah, I'm good. And thanks for sharing me this platform to give some information about the influenza and the flu jab.
It's an absolute pleasure. Oddly enough, flu has entered the building as far as ARN is concerned. My presenter, my colleague, Brandy Scott from the Business Breakfast, basically she's had flu this week. She's been off for most of the days. What other specific symptoms are you seeing in this year's flu strain? She had the lethargy and the general exhaustion and the sort of feeling of nausea. Is that typical?
Yeah, actually, there are two types. One is like a normal cold and flu virus, which will give the very mild symptoms of the fever, mild throat pain, and cough. But when you are affecting with the influenza virus, you may affected with very high fever. You may have too much body pain. Your muscles are feeling like pain, and you feel so exhausted. Along with that, you may have some throat pain and the cough, and you feel really tired. So these are just like a differentiating that you are affecting with the influenza rather than a normal cold and flu virus.
Now, we've been highlighting that those who are particularly vulnerable of catching flu should get the vaccine. You know, why is there such a risk to those people?
Because those who are on the chronic medication, like the patient who are already having diabetes, the patient who are in cardiac problem, they are having the kidney issues, their immunity is already low, and when their sugar is high and they are on the immunosuppressant drug, because of the low immunity, the virus has more chances to get affected and went into the severe condition, like they may need directly admission to the hospital and maybe ICU, and may lead to the further complication, even to death. So we recommend actually for every person who is above the age of 5 years and the more than 65 years of age they have to go for the vaccination, because we found that it's quite a spreadable disease. And maybe if you have a good immunity and you may have the mild symptom, but maybe you're staying with some other family members who are really on the chronic medication, they are more susceptible for those type of risk. So we advise, because this is a spreadable disease, very fast communicable disease. So we advise to vaccination for everyone to get more immune. And it should be every year, because the virus strains they're changing the pattern. They're not in the same. So that's why when the vaccine they are preparing, they are collecting the different strain to get immune for everyone. And even we have seen some young adults who are even not on any chronic medication. They are also affecting, and sometimes they are going to hospitalize and they are getting the treatment.
So, I mean, for example, my kids have got a cold at the moment. You are now allowed to send your children into school if they've got a cold. In the past, when the pandemic was in its full flow, there were sort of slightly stricter regulations. How can you tell the difference between a child, or even in yourself? How can you tell the difference between a cold, a bad cold, and flu? Because obviously, if you've got flu, you shouldn't be going to school with it.
Yeah, basically in that, as I again repeating, because the fever is very high and you feel the child is maybe lethargic and he is no energy, is always exhausted. And when the symptoms are more, he may be dehydrated, too much tired, he may be having the blue lips, he may have the breathing difficulty, shortness of breath. So these are the symptoms which is towards the fever of the influenza. And sometimes some kids are already affected with the mild asthma and having some seizure disorder. So they are always on the vulnerable, and they are affecting fast with these infection. Because yes, we know every medicine, every infection, we should not treat it. But yes, we know these are the typical things. Even it can lead to the death also. So that's why these are very vulnerable, and it is better to protect the kids or even the adults with the flu jab.
How does that flu jab work? Can you just give us a bit of a reminder? Because it's a simple injection, doesn't hurt, but what does it do to your body that protects you from the flu?
Yeah, it is just like a deadly virus. They are growing in the chicken eggs and all. And after that, the vaccine are prepared, and then they are giving just intramuscular dose. And once the virus are injected, they are giving training to your immune system. They are producing some antibodies to get fight against the real influenza. And once you are having the antibodies and your immune system is trained to fight those infections, and once you are coming in contact with a natural infection, you will not affect it so much, maybe very mild symptoms, because your body immune system is trained to fight the infections. So that's why with the vaccine we can get immunity and to fight against those type of infections.
As ever, Dr. Vinod Tahilramani, a specialist in internal medicine at Emirates Specialty Hospital. Thank you very much for your insights. Really appreciate your time there. And yes, certainly key message out of that interview, key message out of the Ministry of Health and Prevention. Go get your flu vaccine. I have to admit, I haven't had it yet, and I haven't got it for the children yet, but maybe that's a little bit of a project for me this afternoon.